whether it is older child or younger child, adopting a child that was not born to you is it itself needs a lot of preparation. So we are supposing that the child has grown up in the institution right from the beginning. The truth is that children come to the institution at different ages in their life due to different circumstances. The best case scenario, if a child has grown up with reasonably caring parents or family, and then due to certain circumstances has to be in an institution and is further placed in a family, already has an experience of bonding and trusting caretakers. So that's a great start. Given the social circumstances, the children who are available for adoption in the care system are often coming from very difficult circumstances. So it's not just about the stay in the institution. In fact, the institutional stay is probably so much more consistent and better than what they would have gone through in their birth families. Yeah, that doesn't mean that we are not comparing the physical care as much as the emotional care. The best of institutions are not able to give that kind of one-to-one care because their purpose is different. Yeah. When we are looking at the trajectory of where the child started its life, what were the circumstances, where did it grow up? It's not only about neglect. Sometimes there can be very distressing circumstances of the situation in that environment. There could be violence, there could be loud conflicts between the parents, there could be poverty, hunger, illness, all kinds of circumstances due to which the birth family is not able to take care of their children. They are either, relinquished or they are abandoned. Sometimes there are stories of being exploited, abused, and with all that history, I don't want to sort of project that this is what all children have. So these are all circumstances that impact the development of the growing child. Coming into an institution, being provided care, being provided medical care, and then being prepared in some way to join a family, it's the best that society can do for that child. And then parents coming forward to adopt an older child, it's a wonderful thought. But you see, the intention is not enough because this child is already used to of taking care of its own self. The child is used to, and why should a child be trusting? Because the child's trust has not been met with consistent care. So there is mistrust for the child. There is a sense of having to take care of its own. A lot of older children who come into families, parents over a period of time recognize that such a child is very self-sufficient. And a parent might want to do for the child. It's the placement, the whole system of which does the placement has to also recognize. Sometimes they do recognize, they do mention it, but they may not have adequate resources to prepare the parents. And the openness to learn about, I'm going into a different kind of experience. And, it's not just about knowing. One has to sort of spend more time looking inward and asking where am I coming from? What am I hoping for? What is the best outcome that I can look for? And naturally, parents also have lots of expectations. The child having to, adjust in the family, and the child comes from a different background. So at the simplest, one is a mismatch of expectation. It's very hard to know what the child is needing or is understanding about family. But the everyday routine and how flexible are parents, how well emotionally regulated is a parent themselves. So these are a lot of things that need to be looked at.